Welcome to the We Talk Health Podcast, the official podcast for West Tennessee Healthcare. Please be advised that this podcast is not intended to replace any medical advice. Always follow your medical professional's advice and direction. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions, please reach out to us at wetalkhealthpodcast@gmail.com, and we will do our best to answer any questions you may have.
Welcome to another episode of We Talk Health. My name is Kwasigroh, and today joining me is Chrissy.Watson. She is from the Star Center here in Jackson. Chrissy, how are you?
I'm doing well.
Good. Thanks for coming on. We also have Rachel.Ryan. Rachel is a certified bereavement counselor for West Tennessee Healthcare. Rachel, how are you?
Good morning, Will. I'm doing great.
Good. Thanks for coming in. I've been insanely excited about this podcast because we're going to be talking today about music therapy and how it relates to West Tennessee and I guess specifically Jackson General Hospital. And for those of you who've listened to this podcast for a while, you might not know that I'm a musician. I've been playing music for 15 years. My degree is in music education. So when I was able to set this one up, I was floored because it's kind of like my two worlds are being married right now, which is pretty sweet. So Chrissy, if you could just go ahead and tell us a little bit about yourself and your background and what you do.
Well, I love what you said about music therapy. I think that is kind of what drew me to the field anyway. I was in high school in Houston, Texas, and just trying to figure out, what I wanted to do after high school. And one of the things that really stuck out at the time, of course, this was years ago, so the field wasn't where it is now, but
right.
At the time, my parents had seen an article, and it was related to music having an impact in a medical setting. And so that was really my first love, I guess, with music therapy. And so talking about this today is just kind of going back to my roots.
Yeah, that's amazing.
Yeah, and so I'm from all over the place. Grew up overseas. We just moved around a lot. My dad was in oil, and so we ended up in Texas for my high school, and then I went to the University of Kansas for my music therapy degree.
Okay, that's awesome.
Yeah, and then I ended up doing my internship in a medical setting as well. We have to do 6 months of an internship in order to finish our degree, like full time. And so I was working with a rehabilitation hospital, neurological rehabilitation hospital down in Houston again. And then I worked in North Carolina for my first job for about 5.5 years. And that's where a lot of my family is. And then I moved to Tennessee for a job to work at the Star Center, to be a music therapist here and also an internship director. We have an internship site that pulls students from all over the nation to come to Jackson to do their internship and learn about music therapy.
Awesome. So how long have you been with the Star Center?
I've been here 8 years, and working for the Star Center 8 years, December.
Gotcha. Okay, so how did you get involved with Rachel, and how did the partnership come about from the Star Center and West Tennessee Healthcare to start this program?
Yeah, that Rachel honestly has been one of the best parts of being in Jackson, being at the Star Center. To have, she's basically a colleague that is able to understand what we do and kind of help us figure out how we would fit in at the hospital. And so that was Mabel, our HR representative, Mabel Pascal, had made connection, I think, with Rachel.
Yeah.
And back in 2013.
Yeah, 2013, I believe it was.
Yeah. And because I had made it known that, I really wanted to work with peds, and I had a colleague at the time who was also a music therapist, and he really wanted to work in the Nicu. And he has a specific NICU music therapy training that he was coming out of college with. And so, so we were all set up qualification-wise.
Right.
And then all we had to do was make the connection, and Rachel gave us a tour of the NICU, and we got to see peds and meet some of the nurses, staff, doctors on the unit. And then she also set us up with a presentation for the medical staff. And so we were able to share with them how music therapy might benefit, specifically in the NICU, because I think Rachel was like, we're doing it in pediatrics.
Yeah, that's awesome.
So the NICU was really big because they had never had music therapy in there before. They don't, Rachel goes in there, but it's just such a fragile environment.
Sure.
Whereas music, you don't even have to be hands-on to make a difference with the family. And so we after we did that little training, I guess, presentation, they were on board immediately. Dr. Go, I think it was.
Yeah.
She was like, well, let's do it.
Let's do it, yeah.
How do we get started?
Well, I know everyone here is glad it's a thing. That's amazing.
We've seen a lot of good things come out of the program over the years.
Yeah, and I'd had some exposure to music therapy when I did my child life internship at Le Bonheur in Memphis, and so I knew a couple of music therapists there, and it wasn't like really integrated there, but they were music therapists training to be child life specialists as well. And so
Gotcha.
in my child life program internship, that's where I met some of them. And so I knew the good that music therapy could provide. And so when they reached out, I was like, heck yeah, let's do it.
Right.
And so a lot of the goals of music therapy are similar to the child life program goals, and emotional support and procedural support and distraction. And so we've been using the word married. So the two things married well together. And so it was just another service that we could provide for our young patients.
Yeah, that's amazing. So a minute ago, you said training for music therapy. I guess bouncing off that idea, what kind of training or licensure do you have to become a music therapist?
So to be a board certified music therapist, which is a national credential, you do a 4-year degree, or at least the undergraduate equivalent. Thankfully, music therapists are really flexible and adaptable, so we have kind of multiple ways to get your degree.
Sure.
To adapt to the people in our profession even, just like we do with clients. But you do your 4-year degree, a bachelor's degree at an approved program. So our national organization keeps track of which university programs are qualified and approved.
Okay.
So you complete your degree. Within that, you do 6 months of an internship. It ends up being a total of about 1,200 clinical hours, which is a lot for a degree.
Right.
But it is, we pack it all into undergrad. You can also go back and get a master's equivalency if someone has like a music bachelor's.
Okay.
So if they
like
already have,
So like I have a degree in music
Right.
education, so
you
I
could go to a master's program.
Gotcha. Okay.
Do a 2-year kind of accelerated course in the therapy part of stuff, because it's basically 2 degrees. Well, multiple degrees. But yeah, you have music courses, you have special education courses, you have anatomy and different science courses and psychology courses and things that kind of come together to create this whole package that is music therapy.
Right.
So it is a bit complex, which is why they're very specific about it's got to be an approved program.
I think anything with music is complex.
Yeah.
Anyone who has any kind of music degree knows that
This
your
is
degree
true.
is going to be insanely complex and insanely busy.
Yeah.
So that makes sense.
So you can do that, and then once you finish your internship, you complete your degree, and then you have to sit for a board certification exam.
Gotcha. Okay.
And so that's massive and gotten a lot more complicated over the years from what I understand from my interns. And then you're board certified and you just recertify every 5 years.
Gotcha.
So it's
Okay.
a very, we uphold, ethics, and we have standards of practice, and we have a scope of practice. And I think people hear music therapy and sometimes they're like, oh, that sounds fun. But it's legitimate.
Right.
That's what I get that too. They're like,
Yeah.
oh, you're the play lady.
Oh gosh.
I mean, yes. Yeah, sure.
Yes, but there's a lot
We'll just
behind
go
that.
with that.
Yeah,
I'm
yeah.
glad it's fun. But yeah.
So what are some of the health benefits of music therapy?
Well, and I love hearing Rachel talk about this, but I'll do my best to say it too. Like she had already alluded to, a lot of times we can work on a distraction for young patients, also bring in kind of like that normalized environment, making it feel, it's music. Like when music is in the environment, it kind of it covers over everything else.
Sure.
And so we utilize distraction. When we say health benefits, my mind is going in 50,000 different directions.
Sure.
But
Well, a lot of times we talk about this a lot. For children, their choices are taken away when they're in the hospital setting. So they're told when they have to take their medicine, when it's time to eat, when they need to do this and that. And so while that structure is beneficial for them health-wise, it also takes away their autonomy. And so bringing in services like child life and music therapy, I know there's techniques that music therapy uses to facilitate choice making.
yes, and the independence is really big for us. Self-advocacy as well, just in general, where, kids can't really speak up for themselves. So we love to, I'll give you an example of what Rachel's talking about.
Sure.
So this is something that typically will happen in any given session in a pediatric unit. We'll come in and we'll have a couple little instruments, and they can choose what they want to play. Maybe it's an egg shaker, maybe it's a drum, we have these awesome things that are called wave drums, and they sound super cool, and they have bright little beads, and so they're very engaging, and that's our main prerogative, is to engage them in whatever music making we're doing, and then they're kind of not even thinking about what else is going on.
Sure.
And so that's huge for procedural support too. I've gotten to do some things with that, but with the choice making, like Rachel was talking about, so we give them an opportunity to lead, like go and stop, or, to tell us how to play, tell everybody else, even if we can join the nurses in at the time and have the patient tell the nurse what to do. That's a great experience for them. Even though it's music, it's somewhat inconsequential, but that feeling of control can really help a hospital stay. And if you think about child development with some of the ages we're working with, I mean, that's critical for them to feel in control of their playtime, kind of, when they're in this very abnormal environment that is very invasive. And so music is non-invasive, but can still be pervasive and can still cover, everything that's going on, and kind of fill the room, fills the room with joy. But from a medical standpoint, we can also see, increased oxygen saturation. We can see decreased heart rate. We can see, just more of that biofeedback that we're looking at while we're doing the fun stuff. That's what we're looking to see, and give them that autonomy, like Rachel had said.
Are you guys able to see that like in real time? So say a patient has like a heart monitor on.
Sometimes if we get a lot of, what do you call them?
Breathers, respiratory kids.
Okay.
Yeah, we call them breathers on the floor. So they're usually hooked up to pulse ox machine, and so that'll monitor their oxygen rate. And then some are on telemetry, so that you'll also get that heart monitor in there too.
Yeah, so if it's there, I'm using it.
Oh, yeah.
If there's a monitor there, I'm going to be watching it. And sometimes, like if they're old enough too, we'll help them be more aware of that too. And so maybe we're doing something and it gets a little low. The oxygen saturation gets a little low, and so we're like, all right, look, you see it went below 90 or whatever. Let's do some breathing. So then we'll use rhythm to work on a steady rate of breath so that they can really fully intake and exhale, and then they're focusing on the rhythm instead of breathing, which is labor, right?
Right.
So if we can take the work out of things, sometimes it actually has more of a health benefit.
That's really cool. So you're saying like focus on the rhythm, as in like you'll play a steady beat and they're breathing in on the downbeat on the quarter note, kind of.
Yeah, or breathe in for 4 and out for 4. Breathe in for 4, out for 8.
Gotcha.
Like we do, right, as musicians when we're like learning wind instruments or something, and or we're warming up for choir or whatever. So it's that idea, but in practice specifically for respiratory goals.
That's so cool.
Well, and think about too, like our asthma patients, for instance, a lot of time doctors will write orders for incentive spirometers. So those are things to help lung expansion. Well, for a 2-year-old, they can't really use incentive spirometers. So I'll introduce things like bubbles or windmills, and if Chrissy's there, we refer her to those patients to do these types of activities.
And we've used kazoos before in the same way, if they can understand the humming aspect of it. We've got these things called quack sticks that one of the nurses really likes.
Yes,
and
they like the quacker. We call it the quacker.
The quacker, yeah.
That's funny.
Yeah, and it sounds like a duck quacking, and sometimes we'll be silly with it, of course, but yeah, they can also blow into that and make a sound kind of like a duck call. So.
Gotcha. Is there a difference between doing music therapy with a peds patient versus, say, music therapy with a teenager or an adult patient?
I would say yes and no. No, because the process is the same. You still do, like, me as the therapist, I'm still looking at, assessment, treatment plan, looking at what the goals and objectives are from the medical standpoint, checking out the chart if that's available, talking to the nurses. Like, my approach is going to be the same, but I would say, I mean, attitude-wise, personality-wise, definitely. Like, I'm not going to work with a 2-year-old the same way I'm going to work with even an 8-year-old.
That makes sense.
And yeah, I think probably if I was going to, like, quantify it, I mean, my vocal tone goes down, my attitude can get a little chill, but part of that is also, and child life is a lot like this too, where you walk in the room and you just take a second to read everything.
Right.
And respond in that way. And
Gotcha.
like I said, engagement is the biggest key. And so if I were working with an adult maybe who had a stroke and their music preference was AC/DC, Iron Maiden type stuff, well, I'm not going to go in and sing Somewhere Over the Rainbow.
Right.
Like, that's just silly. So even within one of those populations, you still have a wide variety between what one patient would be successful with versus another. And it's my job to figure that out and to ask the right questions and make sure that I'm presenting the best environment for them so that they can stay engaged.
So there's not just one size fits all care.
For sure not.
For this,
it's not
very
prescriptive.
Right,
at
it's
all.
very specific to that patient.
Yeah.
So is there a difference between music therapy and just having music played to the patient?
Definitely. I would say the therapist is the biggest difference, but because you can just play music on a unit.
Right.
Like we just talked about, that preference. I mean, if nurses are playing country music and someone's on the unit that had a bad experience with country music,
right.
That's going to be a rough stay. So yeah, I think that if you're just playing music, that's wonderful. You know, we all love music. It does something to the environment regardless, but a music therapist can go in, look at the goals and look at the medical directives and work towards those goals, whereas just listening to music is more enjoyment. Like, I don't go in with a set list that I'm just going to play from. I'm talking to the patient, I'm working with the patient, and honestly, they're the ones who are making the music. Yeah, it's almost the opposite of just playing music in the environment. So, but that's a big misconception. So I'm glad you asked that question.
Yeah, absolutely.
I know a lot of our teens too. It's hard, working with teenagers is a unique thing, and because we take care of, on the pediatric floor, babies all the way through 17 years. Right. So that's a wide range. Sure. So I know many of our teenagers enjoy the lyric writing, and they love the GarageBand app where they can create their own beats and music. And then it's neat because Chrissy will engage them to incorporate that into their stay, like how their stay was going, and using that to direct that.
Yeah, if they need to process anything. We've even worked with suicide risk, some suicide attempts, where they've got a lot that they really need to process. And we're not, we see them once for like 20 to 30 minutes maybe. But a lot of times with those guys, I'll get them started on something and we'll talk through it. I'll introduce the idea and then leave it with them. I can go work with another patient and then come back. And so it does feel a bit more, because, engagement with a teenager takes time. So it does feel like it's a little bit more authentic that way.
Even outside of a hospital setting, just teenagers in general can be hard to engage with.
And also, I get really good buy-in just because I'm different. Like I walk in with a ukulele or with a guitar, or I'm jingling, like it's unavoidable to see the difference.
Right.
And the patients usually light up without me even saying anything. So, yeah. But like you said, teenagers, I love working with kids who don't want to work with me.
Right. It's like a unique challenge. That's cool.
Yeah, and because music can break through that so easily. Man, if I play their song or their artist,
even without words, sometimes just the melody of a tune can kind of tear down walls.
That's very true.
Which is really cool. So you mentioned ukulele and guitar. Are those your two main instruments that you use, or
I do
are
use
there
those
others?
a lot.
Okay.
Yeah, for me, I use guitar a lot. Ukulele is just super transportable, and
Sure.
the ones we have are very easy to clean. Dip the whole thing in bleach. And so sometimes I even leave some on the unit, and I'll let Rachel know and be like, hey, room 51 has these things. I'll come get them later. Because, it was beneficial, and they've got a rough road ahead. So
Right.
I'm just going to leave that with them.
Yeah.
And sometimes we will do kind of like a mini lesson.
I was going to
And,
ask, do you
yeah.
have like a little chord chart for them, or like fingering?
Yes.
Just you
I do.
leave
I
with
have
them.
a little chord chart that I can leave for the ukulele, especially. I can't leave my guitar,
Right.
but yeah, the ukuleles are really easy to leave, and you teach them 4 chords, and they can play most songs. So.
Yeah.
Well, she talked about how the nurses love it too. It is it's more of a stress reliever for them. There's not really any goals necessarily with them, but she taught one of our nurses somewhere over the rainbow.
That's awesome. That's really cool.
So, and she's proud of that.
Yeah. She's going to show her grandkids or something. Yeah. Well, and that should be a benefit too of like having a music therapist on the unit. It should bring a little bit more joy and life, and that's a side benefit that doesn't always get talked about.
Sure.
But definitely some medical programs even have that time allotted, especially after 2020, for staff care, for caregiver care, with the music therapist. And so they will have goals established.
Well, let's talk about that a little bit then. So obviously 2020 and the beginning of 2021 is not great, with the pandemic and all that stuff. So what does care for you specifically look like during the pandemic? Obviously, you're still going into patients' rooms, not COVID patients, I assume.
Well, we actually had to take a break.
Yeah.
So we're just now getting back into it.
Oh, I see. Okay.
Yeah, because technically we're in the volunteer category.
Okay.
So we're for sure non-essential according to the hospital's regulations.
Gotcha.
And so, so we had to take a break from pretty much all the medical stuff, which was really sad. Rachel and I had talked about like maybe doing some virtual sessions over the iPad or whatever, but I think everybody just kind of needed to get their feet on the ground.
Yeah,
So,
that makes sense.
but
Well, in our pediatric census, believe it or not, over 2020 is not anywhere near it usually is. And so the need necessarily wasn't there for a little while, but now it's starting to pick back up, and thankfully we were able to get a donation from the Ayers Children's Medical Center Board to generate the funding for 2021. So we are bringing music therapy back.
Yeah,
Good.
it's so
awesome.
huge.
So-
I just really love that they see us as valuable enough to, and like Rachel fights for us a lot.
Right.
And that's just really nice to have that camaraderie, with work stuff.
Right.
It's just not something you always have. I don't take it for granted.
Right. That's great. So can you give me some examples of like how you've seen music therapy specifically help a couple of patients?
Yes, there's so many things that run through my mind. So Rachel, if you can streamline me, that might be helpful.
Okay.
But I can think of one specifically that was actually towards the last time that I was at the hospital, procedural support with the iPad. So there was a patient who was undergoing, was it finger reattachment?
Oh, yeah. It was some kind of wound care.
Yes. So there were a lot of people that were going to be coming into the room. Patient was later elementary, like, 8, 10, somewhere in there. But, so older, and I got to go in there before anyone else came in. So that was huge, I felt like, to go ahead and establish that rapport and get him started on something that was then going to distract him while they were completing this procedure that had before been very unpleasant. So it was the type of thing, with wound care, you've got, they usually have to go in, clean, do things that's just not
lots of touching.
fun. Yeah, of really sensitive and painful areas. And I think his pain meds had been changed or something too that was also very helpful for that experience. But while I was there, and we had him going on GarageBand, but I was also very involved with, kind of cueing him, prompting him, getting his like redirecting him back to the iPad if they were doing something at the time. But he could use one hand, so the other hand was getting worked on. And he was with me the whole time, really engaged. And if he needed to look over, I just talked him through it. And I was like, you want to watch them for a second? That's fine. And sometimes he'd be like, oh no, I didn't mean to watch
Right.
He'd come back to the iPad. And I was like, all right, what kind of, I kept asking him questions. How do you want this to sound? Do you want to change the instrumentation? Let's listen to it. All right, let's go back and change it. Like there was always something to do to keep him engaged in that instead of watching the procedure and thinking about the pain. And there's lots of research to support even reduced pharmaceutical need because of music therapy reducing that pain perception, specifically during procedural support or pre-procedure. There's pre-op and post-op music therapy that's done. But this one in particular was really memorable because afterwards, his mom came up and we were still finishing our composition. Like they were done with the procedure and we were wrapping things up, but it was like music therapy was really the reason we were in the room at the time, not all of this medical stuff. And so mom came up and said, that was great. And he was like, yeah, I was able to distract myself. Like he was very conscious. He knew exactly what was going on. It wasn't like the wool was pulled over his eyes, but he now had a new strategy.
Right.
For the future too.
That's awesome.
So it wasn't just a one-time benefit.
And we used that, I remember, so we figured out how beneficial that particularly was for him. And so he had wound care over the next days. And so we used that.
Awesome.
Yeah, to continue that support.
Yeah, that's really cool.
I was thinking about, of course, I don't remember all the specifics of the songs that he created, but I remember listening back to it. And you can tell the ones where there probably was some significant pain, and so he would get busy with the notes, or it'd be a high note or whatever it was, or lots of beats, and so you can tell the parts where he was really trying to cope and get through where it was hurting, and then the calm. So that was neat to look back. That's specifically awesome. I mean, nothing I pointed out to him, but just something that I realized.
That's encouraging.
Well, I know for me, like I said, I'm a musician. I play bars, random venues, and then on Sundays I'm at church, so I kind of get the wide spectrum of. And I know for me personally, music does something that I really can't even put into words. Just being behind a drum set playing, it might be like an abstract concept or abstract thing to say out loud, but you kind of go into this like a little bit of a trance because you're just playing, you're focusing on what you're doing, but you're just enjoying the moment. And I feel like as a music therapist, maybe that's the same for you. Like, you're doing your job, but you're getting a lot of enjoyment out of that, watching a patient be in a little bit less pain or being distracted from what's going on.
Yes.
And I think that's really, really powerful.
And helping them get to that place where they can be so zoned into the music that they're zoned out to some other things. So, because music can definitely do that. And we can be more intentional with it, I guess, is kind of my job, is taking the things that we already know music can do and being very intentional with its application.
Yeah, that's amazing. Do patients, families, like specifically ask for music therapy if they're in the hospital, or is it offered to them and they kind of choose if they want it or no?
It goes both ways. Rachel will often let people know, like, hey, and she's really good at figuring out which patients would really benefit. So she's well aware of the caseload on the floor and the census, and so and sometimes we can even call that morning and she's like, yep, I've got 2 for you.
Yeah, so it's more of a referral process.
Okay.
So they come once a week. Obviously this isn't their only job at the hospital. They serve in the community in other areas. And so, and within our system, lots of different programs starting up. But so I know when they're coming. And so it may be that I've introduced the service already or have spoken about it with a family. And then there's some that I haven't at all.
Right.
And so it's more of a referral process.
Yes. And sometimes doctors will refer.
Yes, and nurses.
We have had the rare occasion that a family member will see me in the hallway or something and be like, hey,
can you come in?
We want you.
Yeah.
Right.
So
we just kind of take it case by case.
Gotcha. You said doctors and nurses can refer. I think it's absolutely huge that they recommend you guys, and like you're not just Chrissy with Star Center. You're kind of part of the team.
Yes, definitely. Yeah.
A lot of them don't even really know where she works.
Oh, really?
They really don't.
I have like the name tag. Which I have, but
like our hospitalist, Dr. Davis, is a big advocate for music therapy, and so when she sees Chrissy that morning, she's like, "Oh, music therapy's here today,"
That's amazing.
And so when we told her that that we're starting that back up. She was really excited
Good.
to have you guys back.
Well, and I missed that part when we were talking about how we got started with the hospital. Honestly, one of the first things we did was with the follow-up clinic, with Dr. Davis's follow-up clinic. And we did like a little pilot, but the study, like the participation and the involvement and the connection was successful. Dr. Davis got to see us up front and personal with her patients, and really trying to see what we could do to improve life for that population.
Yeah, so if the patient was graduated, as we say, from the Nicu, then some of them would be referred to Dr. Davis for the neonatal follow-up and developmental clinic, which is still going on now. And so I think you all did a study with them and served in that population for about 8 weeks.
It was 8 weeks per patient, so it ended up being like 6 months maybe.
Oh, you're
or
right.
at least 3 to 6 months. But yeah, it was great. We got to know one of the PTs that was also in the NICU and the follow-up clinic, and we got to know Dr. Davis pretty well through that. And then we just kind of transitioned into the NICU at the hospital.
And then we've talked about our Butterflies Embrace team, perinatal hospice team, and so we've actually made referrals to Chrissy and music therapist at the Star Center for sibling support, for bereavement care. And so we referred the siblings in bereavement care to go to music therapy. So we've done that, and actually because of the referrals that we made, Chrissy and another music therapist had gone through our bereavement training program, so they're also certified bereavement counselors.
Wow, that's awesome.
Yes.
That's really cool.
And we're continuing that too, because we're looking into hospice and stuff. And so we're continuing our training in that. There are, like we had mentioned before with the NICU training, there are lots of other trainings that we can go through that are very specific to different populations. And you don't really get like a specialty or anything in our field. You're just a music therapist, but you can get these certifications or trainings that are very narrow focused and continue your professional development that way. My area is neurologic music therapy, and so that's kind of where my approach finds its home, is looking at the brain and what's happening with the brain and how does music work in the brain in the same way. And if we're like with pain receptors and things like that, not just the brain but also the whole nervous system, that if we're having this reaction to pain, what can we do musically to steer that away or to kind of break that synapse or break those connections so that we can overpower that function. So yeah,
that's so cool.
It's a lot of fun.
You have a background in the stroke.
Yes, that's my
is.
population. Stroke and TBI. I love working with brain injury specific stuff, especially with like communication. I've gotten to co-treat with speech therapists over at West Tennessee Rehab, the rehabilitation hospital across the street. And it's just, my background, my internship was 6 months intensive in a neurorehabilitation hospital. So
that's amazing.
It's a blast. It's great to see how music can not only improve those functions, which is pseudo miraculous, but also to see the patient have hope and experience, like their speech may be different, their gait may be different, but they're still experiencing music the same way. They still get to hear the songs that they like, and we can use that music to add a motivation factor for the mental health piece of rehabilitation that often kind of gets sidetracked with all of the therapies that they have to do to get function back. We often overlook that mental health piece, whereas music can do both.
Yeah, the power of music is more powerful than I guess you realize.
Yeah.
So this is amazing what you're doing.
I'm always learning new things about what I do.
Awesome.
I like that about my profession, that I can always keep growing. And then working with a new patient is just that experience as well. Yeah. Every patient is different and unique, and I get to learn. I think another story I have from the pediatrics unit was around the same age range. I guess they're just my faves, unfortunately. No, it's just, it's a little challenge to work with kids who are a bit resistant, and I like breaking through that. But one patient we discovered, because he was just like going along with whatever we wanted to play. And I found out halfway through that he likes rap. And I was like, why didn't you tell us you liked to rap?
Yeah.
We can do that. Like I might not look like I know what I'm doing with rap, but you can create it, if you like it and you want to, I can help you create it. And so there was one patient, that happens frequently, but there was one patient that I think he was like 7 or 8, and I cannot even remember what his diagnosis or the reason he was there was, but he was there for a while, and I think there wasn't a lot of family in and out. I think there was maybe an uncle or something, but he had his own like rap handle. He had his name, whatever he was going to go by, and he created some really good lyrics and good beats and stuff. And so he was able to record his own stuff. And often I can email the parents, or I'll email it to Rachel, and if she needs to figure out who can get it so that the patient can have it. Yeah. But what they create in the hospital, they can keep. And so it's theirs. It's part of their treatment, basically. So I think that's just really special for them to have something that came from their hospital stay that's not like a scar.
Yeah, creating positive memories out of not so positive experiences.
Yeah.
We're just thankful for the partnership with the Star Center and thankful for AIRS board who sees the need to continue this service.
Absolutely.
And so I think our community, our Jackson community, is just phenomenal in the way that we all coexist together.
To me, it speaks to their interest in, because we get referrals through Butterfly Embrace or through the doctors for other people. Like, they're not even their patients. They're just friends that they know.
Right.
And it just speaks to the desire of this healthcare system and our community here in Jackson that they really value just care, just caring for people. And I think that's huge, because you don't always get that in a hospital system.
So is there a specific website somebody can go to if they want to learn more about what you do?
Sure. Because I work at the Star Center, they can go to star-center.org.
Okay.
And music therapy is one of the tabs in the therapeutic services.
Perfect. Well, this has been awesome for me. I hope so for you guys as well. And you guys at home listening. Music is powerful, like we said. There are boundless benefits that can be found from using music for more than just non-hospital stay. Thank you guys so much for coming in today. This has been insanely awesome for me.
Thanks for having me.
Absolutely. And this has been another episode of We Talk Health.